So I actually became aware of the campaign through social media, and when I saw a post about it, I had that aha moment where I was like, wow, this really is something that needs to be talked about. Low dose, big benefits, it's true. And to me, having that awareness and knowledge is so powerful. My first pregnancy was really pretty easy all along. I felt great. It wasn't really until late in my third trimester, around 35, 36 weeks, that I started to have some symptoms that were atypical of what the rest of my pregnancy was like. And I started to have really severe migraines. This was a next level migraine. Very severe in my eyes, vision disorientation, starting to have flashes of light, and just I knew something was not right. The doctor had recommended that I go into my closest emergency room. It wasn't until they gave me a urine test that they uncovered that I had high levels of protein in my urine, which was an indicator of preeclampsia. And that was just really scary for me to hear. Preeclampsia can be very serious, and having not had any of the hypertension throughout my whole pregnancy, it was alarming to me that it was something that could come about so quickly. When we finally were at a point where I was ready to start to push, my heart rate started to go up and my son's heart rate started to go down. They decided an immediate emergency C-section was necessary. Mason was born 3 days after I arrived at the hospital for induction, and then we spent 5 days in the hospital thereafter as I healed from the C-section. When I went to my first prenatal appointment, they did ask me about having had preeclampsia with my first son, and at that time they had asked me about the low-dose aspirin and if that was something that I had heard of or done with my first, and I had not. With my second son, my OB had recommended that I start with the low-dose aspirin at around 12 weeks, and I did so daily. And throughout my entire second pregnancy, I did not experience any negative symptoms. I didn't feel any different in terms of how I felt against my first pregnancy. So I had no negative adverse experience with low-dose aspirin throughout my pregnancy. Having a scheduled C-section was a completely different experience with my second son. I had a lot more comfort knowing what I was getting into, knowing that it was planned. I did not have the 54-hour exhaustion of an induction prior. So I was in a much different headspace going into 39-week C-section with my second son. So post my experience, I had some additional conversations with friends just around the different symptoms that you might experience and how to raise those concerns with your doctor if you are feeling like any of the things that you're going through are not normal, and really having those conversations early to try and understand what are the risk factors, am I high risk, just being very transparent with your provider, trying to understand what all of the risk factors are and making sure that you're advocating for yourself.